What should you do when you sprain your ankle? Hi, my name is Jackie Dilla. I'm the Director of Physical Therapy in the University Park Health Center. In this video, I'd like to show you what happens when you sprain your ankle, what to do immediately thereafter, and what to do in the days and weeks that follow. There are two common types of ankle sprain. One, where your ankle rolls in and you sprain the medial ligaments, and the more common type is when you sprain the outside ligaments and your ankle rolls out. Regardless of the type of sprain, the immediate management is the same. Early treatment is crucial to minimize pain, swelling, loss of function, and prevent the possibility of developing unrelated problems. After an ankle sprain, think RICE. R-I-C-E. It stands for rest, ice, compression, and elevation. R is for rest. The first thing you want to do is to get off that ankle. If you can't walk heel to toe without a limp, you may need to use crutches or a cane to facilitate proper form and avoid possible injuries such as Achilles tendonitis. I is for ice. To help control pain and swelling, get ice on the ankle as soon as possible. Apply ice for 20 minutes, then an hour off. Repeat this 3 to 4 times each day for the next 3 days. C is for compression. Use an ACE bandage or an ankle brace to provide immediate compression. This will help minimize pain and swelling. When you wrap the ankle, always start at the toes and work your way up to push the fluid up towards the heart instead of down into the toes. If the foot becomes numb after wrapping your ankle, it's too tight. Remove it and start again. E is for elevation. Now elevate the foot. Ideally, this would be above the heart. It'll keep the fluid from pooling in the ankle region and help minimize the swelling and throbbing. In class, you may prop your foot up on a chair.
Hi, my name is Donna, and I work in the Physical Therapy Department at the University Park Health Center. If you have any concerns about the severity of your ankle sprain or the possibility of a fracture, don't hesitate. Please seek medical advice.
RICE is the best immediate sprain management technique. But now I want to show you 3 activities that you can do the very next day. These will help prevent and minimize loss of function, as well as prevent secondary problems such as posterior tibialis tendonitis, plantar fasciitis, and Achilles tendonitis. Calf stretching is the first and most important activity that you can do. Proper technique includes keeping your foot pointed straight ahead, raising the arch up, and gently leaning forward to feel a stretch in the calf. Only lean forward to a point of stretch and not pain. Repeat this exercise 2 or 3 times, and repeat it 2 to 3 times throughout the day. If you are unable to perform the standing calf stretch, an alternative is the seated towel stretch. Toe curl is the next activity. Lay a towel on the floor and simply curl your toes to bunch up the towel. Be sure to keep your knees in line with your ankles. Curl your toes as fast as you can for 1 minute. Perform 5 sets of 1 minute twice a day. After finishing your toe curl exercise, begin doing a set of 20 toe raises. If you can't do 20, just perform the exercise until fatigued. This will assist in increasing your ankle range of motion and strength. The next thing I want you to do is to slowly move your ankle in a pain-free range of motion. Avoid turning your ankle in directions that are painful. After 3 to 5 days of active range of motion, begin using a TheraBand. The TheraBand will add resistance to your movement. For this first exercise, place the TheraBand around a bedpost or a table leg and tie it in a knot. Now slide back until the slack is out of the band and your foot is pointed away from you. Now pull your foot towards you as far as your pain-free range of motion will allow, then slowly return back to your starting position. Repeat this 15 to 20 times in sets of 3. For outside ankle sprains, add the resisted E version to your daily routine by turning your foot out against the resistance. Slowly turn your foot outward and down in your pain-free range of motion. For inside ankle sprains, add the resisted in version by slowly turning your foot inward, always within your pain-free range of motion. TheraBand is available to you in the health center or your local physical therapy practice. Once you can support your full body weight on both legs with minimal pain, it's time to begin doing heel raises. Start with double leg heel raises and progress to single leg heel raises. The goal is to perform 3 sets of 20 repetitions of a single leg heel raise. Remember, stay within a pain-free range of motion. Balance training is the last exercise. This will help retrain the joint receptors in your ankle and assist in preventing a re-sprain. For 5 minutes each day, try balancing on your injured leg. Try this first with your eyes open and your arms out, then with your arms down. Progress to doing it with your eyes closed and your arms out, then down. Standing on a pillow can make the exercise more challenging. When returning to your activity, I recommend you wear a brace, either a lace-up brace or a stirrup type brace. These will give you additional stability to be able to return quicker to your sport while your ankle heals.
These stretches and exercises are geared to facilitate recovery from your ankle sprain, but most importantly, they will assist in minimizing the secondary problems often seen as a result of compensation and immobilization.
Some of these secondary problems can include plantar fasciitis or arch pain, posterior tibialis tendonitis or medial leg and foot pain, or Achilles tendonitis.
Hi, my name is Henry Bibby. I'm the head basketball coach at the University of Southern California in Los Angeles. You know, I look back, my whole career, my whole basketball career in college and professional basketball has been staying injury-free. And one of the injuries I've had now, I guess, is the worst I've ever had. And this is one of the two. I had an ankle injury about a month ago, and I'm trying to recover from that. And again, not being accustomed to having injuries, I'm thinking that I can just wake up and keep going. I've kind of waited on my own for it to heal, and it's not healing. And I've the last couple of weeks I've gone down to try to get some therapy on it and some exercise on it, and I think it's really has helped me since I've done that. I have a little rubber band that I've tied to the bottom of my desk that I sit in here and do, you know, my exercises. I can't always get to the trainer. Again, I don't have that time, so what I have, I can put it right in my house. I have one in my house. I have one at my desk that I can do exercises that the trainers have showed me to do throughout today that have really helped me.
Now, let's review. What's the first thing you do when an ankle sprain occurs? That's right. Think RICE. Rest, ice, compression, and elevation. These are the initial ankle sprain management techniques. Beginning as soon as the next day, you can start stretching and range of motion exercises that include calf stretching, toe curls, and toe raises. Perform all these exercises within a pain-free range of motion. Remember, for outside ankle sprains, combine the resisted dorsiflexion with the resisted eversion using a TheraBand. And for inside sprains, combine the resisted dorsiflexion with the resisted inversion. Finally, when the pain is almost gone, begin doing the single leg standing balance and heel raises to help strengthen your ankle. Continue to do these exercises and stretches for 2 to 3 months after the sprain to ensure ankle strength. Let's review your ankle rehab program. Calf stretching, 3 sets of 30 seconds, 2 to 3 times a day. Toe curls, 5 sets of 1 minute, 2 times a day. Toe raises, 3 sets of 20, 2 times a day. TheraBand exercises, 3 sets of 20 each direction, 2 times a day. Heel raises, 3 sets of 20, once a day. Single leg standing balance, 5 minutes, 1 to 2 times a day. Even after the pain is gone, continue to do these exercises for 2 to 3 months afterward to ensure your ankle strength.
On behalf of all of us in the Physical Therapy Department and the USC University Park Health Center, we'd like to say thank you for sharing your time with us.